Hi, I'm here at the ASH meeting in San Diego and had presented an update on the MURANO study. So a comparison of venetoclax rituximab to bendamustine rituximab in relapsed or refractory CLL. The actual efficacy data had been published. Venetoclax is superior to bendamustine, but what we'd presented here was outcome after cessation of therapy. So 2-year time-limited therapy with venetoclax. We heard in the late-breaking abstract session today development of venetoclax resistance, and toxicity issues, cost issues are the driver for wanting time-limited therapy. So this was the first large study to look at what happens if you stop therapy. So we had 130 patients who got to that 24-month time point and stopped treatment. We've got about a year follow-up on average after cessation, and 87% of patients remain progression-free. So this reaffirmed the feasibility, safety and clinical appropriateness of time-limited therapy. But there was variability. So outcome varied by MRD status at the time of cessation. So those patients who are MRD negative by flow cytometry, or who have low-level MRD, less than 1%, overall they have less than a 10% likelihood of disease recurrence in the first year. A problematic but small subset is the 11% of patients who have high-level MRD at the 24-month time point. They have a high likelihood of disease progression, but on looking back, these patients who had disease progression prior to cessation. So continuing single-agent venetoclax will not be the answer for that subset, and whether early introduction of combinations or alternative treatments may resolve the emerging resistance in that small subset.